high risks must be treated by implementing additional controls. Now, this is where we're talking about the hierarchy of controls, and this is very much sort of a business or a corporate model. We talk about what can you do, or what control measures can you put in place to reduce the risk to the lowest practical level, okay? So, you know, we could stop what we're doing completely, okay? But that's probably not advisable in certain circumstances. We can't stop providing care, okay? We could stop allowing somebody to get out of bed. Again, that's not advisable, okay? Because it's restraints, it's seclusion, all of that. So, by avoiding any potential risk, by deciding not to initiate or continue with the activity that gives rise to the risk, avoiding, removing the potential risks, changing the likelihood of the risk occurring. When we went back to the second or third slide, I think it was, we moved by cheese. We might be able to change the risk, but we might be able to look at how people are with managing that risk. Okay? Changing the consequences should the risk occur. So, what is the impact for the resident or service user? And sharing the potential risk with external party, including contractors. So what do we mean by this?
Getting somebody with a specialist expertise maybe to
Absolutely, absolutely. So if we use, yes, you can look at bringing somebody in and bringing in people that do external audits for you and all of that, and HCI does offer those facilities. But if you take it in something that's very simple, if you look at your pharmacy, and I'm using medication again, okay, I know, but if you look at your pharmacy, your pharmacist has obligations that they need to do the stock checks, they need to do audits, they need to review your residents' medication or your service users' medication, and they need to do all of these control measures for you. You're spreading that risk rather than trying to oversee that particular process yourself, because aside from Karen in the room, the rest of us may not be pharmacists with that skill set. So, like the waste management, they have specialties, absolutely, they have agreed protocols. And what I would say to you around sharing your risk with other providers, including contractors, is we still have an obligation and we still have overall responsibility for that. So just because we've outsourced a particular service to a contractor doesn't mean that the contractor is now responsible for it. The ultimate responsibility lies with whomever the signature is on the risk register and on the policy. So whether that be your board of management, the director of nursing, the person in charge, regardless of it being outsourced, we can't use the excuse, well, I sent that over to the chemist to do that. It's our job to oversee that that's being managed appropriately, and your control measures in place for that may be a policy and procedure around approved supplier listing, checking the credentials of your supplier, doing an annual review with your supplier, gathering all of your your complaints or incidents around that supplier, and staff feedback where things may have gone wrong. So, you know, selecting your supplier is important, that you vet them appropriately, that you're not just going with, well, he's the cheapest going, or she's the cheapest going, that you look at reputation and you have a standard criteria to apply when considering putting somebody on your approved supplier listing. Okay? Now, sharing the potential risk we spoke about and retaining the potential risk occurring by informed decision. So this is very much what we were speaking about earlier. We may, as Dan and Connie have discussed, decide, well, this is a risk, it's the nature of what we do, we're going to have falls, we're going to have behaviour that challenges, we're going to have facilities difficulties because we have an older building. You know, we may decide, okay, this is a risk, we'll keep it on the risk register and we'll monitor it on an ongoing basis. And we will put a 5-year plan in place on how we're going to refurbish the premises, or how we're going to try and secure additional funding, or we will review best practice with regard to dementia or behavioural challenges. We'll make sure staff go on all the available courses to make sure we're in line with evidence-based practices out there and any new and upcoming practices that are discussed under literature reviews. So really that's all you can do. It has to remain at a low monitored risk, or indeed a highly monitored risk in the case of somebody that has complex needs in their individual care. Okay? It may not be practical to reduce something to a no risk level, and I guess you would kind of query if somebody was doing a risk assessment if it was no risk, has it been calculated correctly to begin with? Okay, considering the nature of the industry that we're in. Now, we discussed earlier, once control measures have been selected, we agree a timeline and a person responsible. We should not be leaving any of our team meetings and leaving the meeting having not agreed who is the appointed person responsible for that risk and putting the control measure in, and when will it be done. Okay? And there needs to be minutes kept of these meetings and what the agreements and timelines were. Okay? And that is covered on the summary page, which I'm going to show you now. Once the control measures have been implemented, the risk level, so we said here, once the control measures have been implemented, okay, the risk level must be reassessed. So this is after you put those control measures in place. And Connie had, if you don't mind me saying, an excellent question just before we go for lunch, and she said, you know, do I put it down that it's a low risk from a medium risk? Is it like a guessing game, or do I wait until the control measures are in place? And as we said earlier, once the control measures have been implemented and in place, then your risk is reassessed. Because how can you risk assess something that's not in place yet? It's hypothetical, okay? So your risk level, as we said earlier, is impact by likelihood. Remember, impact should always remain the same. We are trying to reduce the likelihood, okay? The residual risk remains, i.e. the potential risk occurring once the additional controls have been implemented. So the residual risk will remain once the potential of risk occurring has been implemented. So, we talked earlier about what if we're, and naturally we'll do this before you even do the paperwork, what would be important to have in your facilities, policies and procedures, and what is missing in a lot of the policies we would look at is the escalation protocol for where something is very high risk. Okay? So it might be an incident. It doesn't necessarily need to be a risk. It might be an incident or a complaint or an audit that you identify something very high risk on. You need to agree with your teams what your escalation process is internally for where you identify something high risk. Who are the personnel you would contact? Including the consideration for out of hours, if it happened in the evening or weekends. Who is the appointed deputy in those circumstances also? Okay, is there external reporting required? Is a nominated member from the senior executive team notified? So they're all just, I guess, kind of ideas I'm giving you on it. And like that, the chances of something like that happening are quite slim, but nevertheless it can happen. And it will always happen on the weekend, and it will always happen on an evening or a bank holiday, okay? So having a plan in place is a good idea. And also making sure that everybody is very clear on who to report to when these things happen. And I'm not talking about just internally, I'm talking about external reporting bodies that you might need to report to. The Health and Safety Authority, HICWA, the Irish Medicines Board, like not just HICWA or, you know, depending on what facility that you're in, allergic reaction to medication. I'm back to Karen again, she's the expert on these areas. Infection prevention and control, you know, an outbreak of an infection obviously needs to be reported as well. Okay, so that's what I mean when I say escalation of risk, and that should be in your protocol or your policy. Okay, and it's particularly important when you have a number of units that are overseen by the same management team, that every unit is very clear on who to contact in case of an emergency.